Well, good evening, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. And we're very pleased tonight to introduce the topic of health once again and the progress we're making and not making in our city through the efforts of our mayor and his staff and clinics like uh, the Agape Clinic. I'm going to turn this over now to our uh, public health intern, uh, Iniola Fatimayan.
Yes.
So please take it away, Ini.
Okay. Hello, everybody. Thank you for being here. I'm an intern. My name is Eni. I'm an intern at the Jacksonville Urban League. Today, my town hall will be on, actually, I can share it. Sorry, my bad. Today, my town hall will be on building a healthier Jacksonville, a town hall where we'll be discussing expanding access, innovation, and community well-being. Can everybody see this? I should probably see it.
Yes.
Okay, great. So first I want to explain what is happening. So in Jacksonville split into 6 health zones, and these health zones have varying health disparities. Those with the best health outcomes are located in the east of the St. James River, I believe, while those with the worst are located in the urban core and out west, as you see here in this image. Those in the best health outcome, which is here in Health Zone 3, and those with the worst health outcome, Health Zone 5, there's almost a 16-year difference life expectancy. So that means people who, even though they're born in the same city, like on their birth certificate, will say they were born in the same city, there's one person that will essentially guaranteed to live almost 16 years longer or almost 16 years shorter, just based on based on where they live. So why is this happening? This, I think, can partly be explained by social determinants of health. Social determinants of health, for those who might not know, are non-medical factors that affect health outcomes. I think personally, at the basis of these social determinants of health is just like racial makeup. As we see here in Health Zone 1 and just overall towards the west side of St. James River, where you see a lot of the poor health outcomes, they tend to be more majority minority, and which might explain why they have poor health outcomes. As we know, there's been a lot of like just historical mistreatment with minorities in the health sector. I also think that this like racial makeup can maybe help, like people might want to help when health, how to like reach these people, like, hey, like how do we help reach these people? Why they might not exactly be trustful of health, out health, like health reach, yeah. And all these other images are essentially just explaining, just mapping out what other health, whatever those other social determinants of health. So we see here we have median household income. Again, as you can see, there's a pattern between your health outcomes and of these other social determinants. So household income, poverty level, and high school education. And these social determinants, they tend to be kind of like cyclical. So like, for example, again, median household income can be explained by high school education, and high school education does have an impact on your median household income. So all of this is kind of just like this circle of how maybe poor health repeats through generations or over time. It doesn't exactly seem to, without a resolution, does not really seem to stop. And with this, I think there's some people who actually are trying to help solve this issue. One of those people or one of those organizations will be Agape Health. And over here, we have a speaker with Miss Mia L. Jones. Miss Jones serves as the Chief Executive Officer of Agape Health Community Center, a federally qualified health center serving Duval County, Florida, a nationally recognized healthcare executive and advocate for health equity. She has led organizations' growth and transformation since its transition to an independent FHC in 2016, expanding access to high-quality primary and preventative care for underserved communities. Prior to her healthcare leadership, Jones served 8 years in the Florida House of Representatives, including as Democratic leader pro tempore, where she championed healthcare access, workforce development, and public policy initiatives. She is an active member of Women Business Leaders in the U.S. Healthcare Industry Foundation and serves as several community and healthcare boards. A distinguished alumna of Florida A&M University, Ms. Jones has received numerous honors recognizing her leadership, service, and lasting impact on improving community health outcomes. Ms. Jones come over and speak to the town hall and share the work that Agape has done.
Thank you so much. Yes, Agape has been in Jacksonville now since 2004, and we are excited and committed to continuing to provide primary care services to insured as well as uninsured patients throughout the city. We have 4 locations, Dunn Avenue, University Boulevard, King Street, and Blanding and 103rd. Each of those locations provides healthcare for adults and for children. And then we have behavioral health services that are provided at each of those locations. And at Dunn Avenue, and soon to be at our university location, we'll be providing women's health services, OB services. We probably see just over 10,000 patients a year and unduplicated. And we work with a lot of patients who have many chronic diseases and have difficulty accessing healthcare.
Okay, thank you very much. So I have a couple questions for you regarding your work, as one of the work that Agape does. So wondering how you guys identify, engage, and build trust with people in neighborhoods that could most benefit from the health education and services that Agape provides.
We work with our outreach team and with other community partners to help people within the community to identify the services that we have and that we have an open door policy. We don't turn anybody away for their inability to pay. They are welcome. Word of mouth is really the highest tool that we have when we have patients who share their story and their ability to get the care that they need with their families, their friends, their communities, their churches. That seems to be the primary way that we get our patients.
Hey, that's good. So how do you evaluate the effectiveness of these programs?
Our evaluations take place primarily through the federal government, which is our largest funder, and they require us to keep track of the number of patients that we have, demographics on those patients, the types of illnesses that they may be experiencing, and the services that they need. So we work with our community partners and with the federal, state, and local government in order to make sure that the community has the services that they need. When we see that there are disparities, we'll apply for grant opportunities, or if there's a funder who's committed to a particular diagnoses, then we will work with them in order to support the research that they might be interested in doing. And that seems to be the primary way that we've been working.
That's cool. I guess what have you seen as successful, between when Agape first started and now?
The number of patients that we've been able to see continues to rise. We are able to, we've been able to expand into the area of behavioral health, which is, we've only had that service for a year now. And we have been booked ever since we started, looking for ways to expand the pipeline of providers that are available to the residents within our community. We have a grant with Florida Blue that is supporting us being able to increase the pipeline. So we are working with students who are going through and completing their education. They are interning with us from both JU and UNF. Those students help us to expand the number of providers that we have available. And we know from hearing from those in the community that behavioral health is a critical area. that is support is needed in. And so because we heard that, we applied for a grant to support that, and now we're rendering those services and expanding that population.
That's very good. It's very impressive. Thank you for your work. Just wondering maybe if anybody else in the audience has any questions for Ms. Jones. No questions. Okay.
Actually,
Okay.
I do
Oh.
have a question.
Mhm.
Good to see you, Mia.
Always good to see you.
What is your biggest challenge right now going forward for the next couple of years? I know we've encountered significant ones from the government level. I'm wondering if that's had an impact on you. I don't mean to modify your response. Generally, what are your challenges?
Our challenges, of course, we have the changes within the Medicaid system and the Affordable Care Act. So many people who previously were insured and able to be seen with us,
Is
and
there a
we be able to
manager?
be
So are you the
paid.
manager? No. Are you the manager? Yes, ma'am. I was gonna say because nobody knows how to avoid a transaction and charge something else.
Do we want to mute everybody else?
I think we're okay now.
Okay. I forgot what I was saying.
Challenges. Medicare.
Medicare,
Medicaid.
Affordable Care Act. So the Affordable Care Act, many people had the opportunity to have subsidies to assist them in covering the cost of insurance. As a result of them having that insurance, we were able to see them, which then allowed us to have additional revenue coming in. I tell anybody who asks me, for us to be able to see patients without insurance or patients who are not working at the time, we are able to see those patients because we have revenue coming in from those who are insured. And so for that number to decrease, that's going to increase the amount of funding that we're going to be looking for and seeking from other sources in order to address the needs that we're finding within our community. I will say that many of our patients have transportation issues. We provide transportation to them if they let us know that. Sometimes they don't say anything, and we'll find out after the fact that, oh, the reason they didn't show up for their appointment was because they didn't have a way to get there. So we work with Jax Care Connect. We work with the City of Jacksonville and our partners in order to make sure that the services that are needed for our patients, that we can get them the assistance that they need.
Thank you.
Okay. No questions for Ms. Jones.
I have a
Thank you.
question, please.
Okay, great.
Ms. Jones, how are you able to capture your data for your clients and or patients? Is it quantitatively or qualitatively?
Quantitatively, we have our electronic medical record system. And then what we do is look into that system and see the types of diagnoses and things that the patients are dealing with. And that's how we try to gauge what types of programs or supports that we are looking to implement within the community.
So there's no additional like implementation of surveys or any, you don't capture beyond the data
We
that's
have surveys that we do for our patients as they are seen. So we have a customer survey that they receive. Unfortunately, we probably only have about a 15% return on those. Oftentimes the patients don't respond to that. And so we have to go based on the information that we have.
Thank you so much.
You're welcome.
Any more questions? Gone. Okay, thank you, Ms. Jones.
Thank you.
Next, we have, for our next speaker, we have Dr. Joshi. Dr. Sunil Joshi serves as the Chief Health Officer for the City of Jacksonville, a role created in 2003 under Mayor Duna Deegan to strengthen the city's public health strategy. A Jacksonville native, Dr. Joshi completed his undergraduate and medical education at the University of Florida before entering practice as an allergy and immunology specialist. Across his career, Dr. Joshi has become a prominent voice for community health. He's appeared frequently in local media, led Northeast Florida Medicine as editor-in-chief, and held major leadership, including past president of the Duval County Medical Society, the UF Medical Alumni Association, and Florida Allergy, Asthma, Immunology Society. He also serves on the board of directors for the Florida chapter of the American Lung Association. As co-chair of #FluVaxJax, Dr. Joshi works closely with city leadership to increase the flu vaccination rates and advance public health initiatives addressing food deserts, gun violence, and physician burnout. His work reflects a longstanding commitment to improving health outcomes and strengthening community well-being across Northeast Florida. Welcome, Dr. Joshi.
Thank you, and thank you for that introduction. And it's always hard to follow Mia, right? Mia's got great information, and the work that they do at Agape is truly remarkable. So, and thanks for allowing us to speak here today. Basically what I would like to do is kind of follow up on some of the things that were talked about a little bit earlier, which includes the social determinants of health and where we stand with our health outcomes here in Duval County, and then what we are doing with the leadership of Mayor Deegan to try to improve those health outcomes here in ways that we can do it with minimal budgetary dollars by communicating and collaborating with some of our partners here in Jacksonville. So Indy's going to help me move the slides, so we'll go on to the next slide. Okay, so I think most of you guys know this is a great place to live, work, and play. Jacksonville has a lot going for it. We're listed routinely in U.S. News and World Reports as one of the top places to live. I looked it up last night. We're number 7 on their list now. 6th best place to retire, hot job market, 4th fastest growing city since 2020. All of this is great. We had 17,000 people move to Jacksonville each of the last 2 years. But as everyone on this call knows, we have a lot of challenges. And so you may not know that the University of Wisconsin does the county health rankings for each state, each county in the United States each year. Florida has 67 counties. Duval County typically ranks below average in health outcomes compared to our colleagues here in the state of Florida. And you could all go to countyhealthrankings.org and see the latest data on that. But I'm going to expand a little bit on this. And so how do we determine health outcomes? There's so many different ways to look at it, but the way that the county health rankings are used and the way that people determine whether this society, this county, this city, this state is a great place to live in terms of health outcomes is to look at something called the premature death rate. And if you've never heard of it, what the premature death rate is basically we look at each person as a gold standard is to live to be 75 years of age. Okay. The premature death rate is calculated over a 3-year period, and the most recent one was 2020 to 2022, and they just recently released the data up to 23, but it measures the number of life years lost per every 100,000 population. So for instance, if someone dies at the age of 70, that's considered 5 years lost. If someone dies at 1 year of age, that's considered 74 years of life lost. So you can see the younger somebody dies, the more years of life lost that you would have, that increases that premature death rate. And so the premature death rate in the United States is 8,400, okay? 8,400 years of life lost per every 100,000 population. In the state of Florida, the premature death rate is 8,600. 8,600 years of life lost per every 100,000 population. The next slide tells you what the premature death rate is in Jacksonville. and it's 11,400. So we talked about 8,300 in the United States, 8,600 in the state of Florida, but in Duval County, it's 11,400 as our premature death rate, much higher than our colleagues. And why is that? And here again is another, this is just a graph looking at that same number. And I show this mainly because what you can see here is this isn't a new thing. This has been an issue all the way back to 2004. So we're looking at 21 years ago. We were way above the state average even back then, whereas you can see the state of Florida kind of mirrors the United States average, but we are above that all the way through 2021 in this particular slide. So this is not a new phenomenon. And Annie talked about this earlier. There are many reasons for that. The social determinants of health are the primary reason for it. And what a lot of people don't realize is that only 20% of the health outcomes, 20% of how well we do as human beings in terms of health, are related to what happens when we talk to our physician or our healthcare provider. The other 80% are determined by these social determinants of health, whether it's our physical environment, what kind of air quality we have, the water that we have, our housing, which is a big issue in Jacksonville, of course, public transportation, or the social factors, socioeconomic factors, as you saw earlier on those slides. The income and education go hand in hand. Income and education go hand in hand with employment, which is why it's so important for us to increase opportunities for people to work. And then, of course, the healthy behaviors, diet and exercise and alcohol, all of those things also contribute to the social determinants of health and ultimately our healthcare outcomes. And so the social determinants of health look at 5 key areas, and the Healthy People 2030 principle is kind of how what we're looking at as we try to improve health outcomes here in Northeast Florida. And that includes healthcare access and quality, educational access, social and community context of where you live and the crime in the areas you live, economic stability, having a job, for instance, and your neighborhood and built environment. Do you have parks? Do you have sidewalks? Do you have lights where you live? Grocery stores, things like that. And so there are a lot of different groups doing great work here in Duval County, whether it's the Department of Health or not-for-profit hospitals or not-for-profit clinics like Agape and so many others, Blue Zones here in Jacksonville. Our city council has put together a critical quality of life issues task force back in 2022. The mayor's transition team also worked on a lot of these issues, and all of these not-for-profits. There's so many people looking at ways to improve health outcomes here in Jacksonville. And the problem with that is that we tend to work in silos as a result. So what can we do in the short term? And this is why the mayor put together a team with me and Lynn Sherman, who's also on this call, the executive director of health programs here in Jacksonville, is to bring these groups together. So many groups are doing work, but a lot of them are working separately. So what we want to do is bring these groups together, understand what each group is doing to improve health outcomes, improve the quality of life. And you need a leader organization to kind of corral folks and make sure that we're all moving in the same direction, support the programs that are working, and have people communicate and collaborate to make this work. And so the City of Jacksonville is the lead organization to bring these groups together, whether it's infant mortality or healthcare access or education or housing. We can drive that bus in the right direction. And we do that by collaborating with each other, communicating on a regular basis, educating the population, and supporting these initiatives. And so we do have some health programs that you'll also see coming up in our budget as we go into this budget season, which is a very stressful time for some of us. But these programs are here to help us reduce infant mortality, to improve awareness and access to mental health services, well-being resources, reduce elderly food insecurity, and to improve access to primary preventative care while keeping people out of the emergency room. So reducing infant mortality, this slide, many of you have seen, this is straight from the Florida charts, Department of Health here in the state of Florida. Blue is Duval County. Orange is the state of Florida. And you can see these are infant mortality rates. The rate of dying babies for every 1,000 live births throughout the state. And you can see the infant mortality for the state of Florida stayed right around 6% for almost 15 years now. And for Duval County, it's been kind of up and down. We've stayed above the state average for all of these years. And those social determinants of health have a lot to do with that. So what we have seen, though, through the years is that there has been a decrease in infant mortality here in Duval County. So over the last 18 years, there's been about a 34% decrease in infant mortality and a 24% decrease just in the last 8 years as well. So there are some things that are working. And in particular, the state has a Florida statute 383-14 that requires obstetrics and gynecologists to offer a screening utensil for pregnant women. And this helps to identify women who may be at risk and can set them up for home visitation, visitation programs as well. Community health workers do a great job here in Jacksonville, which we'll talk about in a second, with home visitation, education, identifying resources that these women and young families can get connected to, which little things like that can have a huge impact in infant mortality. And so part of our goal here is, of course, to reduce infant mortality and improve maternal health outcomes here in Duval County. And our strategy was to try and get 3 community health workers out to an organization that serves pregnant women and families and infants as well. Increase the number of homes that people are canvassed by over 200 so that we can educate people on health services, social services, sleep-related injury for babies, which we know are the #1 cause of infant mortality. Connect these women to home health services and educate members of the community about whether it's toxic stress, safe sleep habits, premature labor, preeclampsia, all of those things that can help women throughout the pregnancy process. And this is a program that was competitively bid and won by the Northeast Florida Healthy Start Coalition. And so I'll just go, these are some outcomes just for this year here in 2026. They do have 2 or 3 community health workers that work for them at any given time, supported by City of Jacksonville dollars. They've engaged just in the first 6 months of this year over 1,600 women and families of people who are pregnant or looking to be pregnant. The top zip codes are those zip codes that were mentioned earlier, the zip codes that are in the Health Zone 1 and Health Zone 5, 32208 and 32210. They've gone to CPAC meetings and community events. They've interacted just in this year, the first 6 months, almost 400 pregnant women, 170 who had just had babies, and over 600 community members at large who can also reach out to pregnant moms. Every single one of these people received education regarding preconception health, safe sleep habits, infant mortality education, and 171 of these pregnant women completed their Connect surveys. These are the surveys we talked about earlier that can identify risk factors that these women may be predisposed to, lack of insurance, no annual preventative care, no prenatal care. And so after getting these surveys out, 63% of these women were referred to home visitation programs, which means that there is a true need for this. And again, this wouldn't have happened without the community health workers. 49%, almost 50% of them have received help through the Hey Mama mobile pantry, which also provides a lot of services and resources for pregnant women. And so there are some very positive data points to look at here over the last few years. The number of infants who have passed in the first year of life has significantly decreased by 8.5% over the last few years. And if you look at 5-year gaps, so if you look at 2015 to 2019 and then 2020 to 2024, there's been an almost 8% decrease in infant mortality. So significant movement. You're starting to see these numbers move in the right direction, even though we have a lot of challenges. The numbers are moving in the right direction here. And what's really impressive is that decrease in sleep-related deaths. Okay, so the low-hanging fruit for infant mortality is sleep, right? So when we have a housing crisis like we have in Jacksonville, and you have multiple people living in an apartment or multiple people sharing one bedroom, where's the baby going to sleep, right? So understanding that there are some simple things that can be put into place. Home visitation programs make a huge impact in sleep-related death rates. And you could see that there has been a 46.7% decrease in sleep-related deaths here in Duval, in Northeast Florida. And this next slide kind of shows that 1.5 out of every 1,000 live births were related to sleep-related deaths. That's down to 0.8, and that's been a decrease over the last 3 years. Significant decrease there in sleep-related infant mortality, which is huge for us as we move forward, because that, of course, is the group that needs to be targeted. Okay, so that was our infant mortality program. Now we're looking at our hospitalizations due to mental illness and programs to bring awareness to mental health programs that we have here in Jacksonville. And so this slide I like to show because back in 2022, if you look at hospitalizations from mental health disorders, mental disorders here in Duval County, we had over 1,044 per every 100,000 population. The state average was 920 per every 100,000 population. So we were way above the state average, about 13 to 14%. And so our goal is to improve access to mental health resources. We have mental health resources in Duval County. We have a great 988 call center here in Duval County. We have a pediatric provider that provides behavioral health support for children and families to try and prevent hospitalization and Baker Acts. And so we wanted to improve access to these resources. And so the 988 call center is one of our big players here. When we first got into office with Mayor Deegan, Lynn Sherman and I sat down with the mental health coalition, and we talked about the 988 crisis center, and we learned that they were receiving increased numbers of calls per month, every month, that was making it very difficult for their crisis managers to continue to pick up the phone at the rate that they had been previously. The goal of the program is to be able to pick up at about 85%. So when somebody calls a 988 number, they would like to pick it up locally at least 85% of the time, because the calls otherwise go to a national call center. And when they go to the national call center, the folks in the national centers don't know about the resources that we have here in Duval County. So they're much less likely to be able to help the person on the other end, and are much more likely to send them to the emergency room. And so we added, with city funding, we've been able to add 2 additional crisis managers and a program director for the 988 system here in Duval County. They're receiving about 1,730 calls per month, which is 15,647 so far in this fiscal year. They're picking up 14,000 calls a month, or 1,400 calls a month, which is about over 12,000 calls answered so far in the first 3 quarters of this fiscal year. This is a 42% increase in call volume in quarter 3 of 26 versus quarter 3 of 25. But they're still able to answer the phone at an 82.7% rate, which is pretty impressive here in Northeast Florida. And in Duval County specifically, they're picking up 88.1%. So that is above their threshold that the 988 folks would like to have for people picking up the phone. We're at 88.1%, despite the increased call volume. So having those additional crisis managers does make an impact. And compared to the state average of only 73.3%, significantly better here in Duval County. It takes them about 25 seconds to pick up the phone. And what's most impressive is the de-escalation rate is 98.7%, which means only 1.3% of these folks do they have to refer for Baker Act or hospitalization. So the more access or more awareness that we can bring to the 988 number, more people utilize the service, more people can be kept out of crisis and kept into services. And then with our behavioral health, I mean, I don't need to tell you guys, I think most of you all know that we have about 1 in every 5 children suffers with some sort of a mental, emotional, or developmental behavioral disorder. That's 20%. So in a classroom of 20 kids, you're looking at least to four of them having some sort of a behavioral or developmental issue. 17 to 22% of children between the ages of 3 and 17 have been diagnosed with ADHD, anxiety, depression, or some sort of conduct disorder, and almost 10% have been diagnosed with anxiety. So mental health support for our Medicaid-based age children, or for Medicaid children in particular, is not just important. It should be a priority and is truly essential for us to get our kids through school and through their educational process. And so we support a program with Angel Kids Pediatrics, which is a private practice here in Jacksonville that does work in underserved areas and is all over our community, and in particular in some of our more underserved areas. They have over 38,000 patients, in which 52% of them are Medicaid. So these are that high volume group of people who are at risk of having mental health disturbances in childhood. And so they've done over 24,000 social determinants of health screenings over last year. They do case and care coordination for over 9,000 families. And have identified over 21,000 social determinants of health risk factors and have almost 3,000 people receiving therapy. So doing a lot of this work to try to keep our children in school and out of the hospital with mental health crises. And so this is the little flyer that they have with the impact that they have made here, which is basically what I just talked about. What's also interesting is they help with literacy, which of course we know is a critically important stage in education, right? If you can't read, it's kind of hard to get that high school diploma. They've handed out over 16,000 books in the last year. And so I showed this slide because I love to show the change in the mental health. And I think the next slide shows the circle around the top number there. But so for the first time, just so you know that there is positive movement in our mental health numbers for the first time in 13 years. You know, I showed that first slide that showed that we had over 1,044 people in Duval County out of every 100,000 that required hospitalization or mental health disorders. For the first time in 13 years, that number has dropped below 1,000 per 100,000. It was an 8% decrease in 1 year and 10% decrease over the last 2 years. And so you can see there is a movement of keeping people out of the hospital with mental health related disorders. So bringing awareness to some of these programs does have an impact. Okay, so food insecurity in our elderly population, which is one of the priorities of the mayor's transition team. Over 156,000 residents over the age of 65 here in Duval County. And in 23, 4,000 of them were food insecure, 2,800 people on a waiting list. So our goal is to reduce hunger in this group, food insecurity, and improve people's quality of life. We did a competitive bid, and Urban Jacks here in Duval County won that bid to provide food for the elderly. And they do this in a very unique way. And in this particular fiscal year, or at least since July of 2024, what we've seen is the waiting list started at 2,800. They've served an additional 1,973 people. The current waiting list is actually over 1,260. 55% reduction in this waiting list. With the city funds, they've been able to serve an additional 435,000 meals since this program developed or became a reality in July of 24. And the clients have been surveyed. 99% say their nutritional needs have improved. 98% state that their meals have improved their quality of life. You can see the data here. This is a nice little graph that shows how the meals have been served over time. The funding for this program was decreased last year. And as you can see, as the funding decreased, the number of meals served per month has also decreased over time, unfortunately. But again, we're working on ways to do this in a way that can be more cost effective to increase the number of meals served as well. And then finally, increasing access to primary care. And so you have to be innovative as you're doing this. Mia talked earlier about some of the changes that have happened at the federal level with the Affordable Care Act and the subsidies going away, making insurance very difficult for people to obtain, actually cost prohibitive. And so the number of people being uninsured are increasing. You have to have some sort of infrastructure in place to keep these folks in primary preventative care and out of the emergency room. That's good health for all of us and not just the folks who can't afford it. So part of this was for us to develop a telehealth virtual program so that we can capture people who feel like they need to go to the emergency room who may not have a true emergency. So they call and we did this as a competitive bid, and that went to Telescope Health as part of our Health Inc. Jacks program, which we'll talk about here on the next slide. And so this is Health Inc. Jacks. For those of you who don't know, it's a phone number available to everyone who's uninsured here in Duval County. You call that number 904-925-CARE, CARE, 925-CARE, and you get a nurse, a triage person who will pick up on the other end and talk to you directly and triage you as to whether or not you need to see a doctor, whether you need to go to the emergency room immediately, or whether you need to just have a social determinants of health evaluation with a nurse case manager. And they can set you up directly to see a doctor right then and there through a link, and you get your visit that way. And it doesn't cost the individual any money. And so this program, which kicked off officially in October of 24, has taken over 11,000 calls, 11,200 calls, over 7,000 encounters with either a physician or a nurse navigator. 2,000 of these calls were with a physician here in this year. So this fiscal year 26 through quarter 1, 2, and 3, over 2,000 physician encounters, which is a 68% increase from a year ago. More people have heard about the program and are utilizing it. They have had over 2,700 people avoid emergency room visits during this time, based on survey data. 42% of them would have gone to Baptist, 22% to Shands. It looks like maybe the other stuff got cut off, but you can go on to the next slide. Yeah, and there are a bunch of other hospitals listed there. I'm not sure what happened to that, but then JacksCare Connect is part of Mia's group is part of JacksCare Connect. So JacksCare Connect is this overseeing organization that helps funnel patients to 6 free and charitable clinics, which includes Agape, Sulzbacher Clinic, Community Health Outreach, Mission House, Mass Clinic, and Volunteers in Medicine. And so they funnel people into these different clinics based on their need, based on transportation, based on their insurance level, their work status, so that people can get the care that they need. And they do that with patient health advocates. And this group was actually identified through the Critical Quality of Life Issues Task Force as a group that needs to be funded, so that we can continue to allow this group to be successful. And then the Duval Safety Net clinics, which include those 6 clinics I mentioned, including Agape, receive $1 million split up amongst all of these individual clinics, $166,000 each, to help support those clinics so they can continue to do their work when we know that we are challenged in so many ways with health insurance and healthcare access. And these groups have done incredible work here. And I guess the slides have been cut off. So I had these slides are in different boxes. But anyway, I could at least talk about the fact that the JacksCare Connect system itself has seen 125% growth just in this year alone. And this is just through the first 3 quarters. So their total right now is 125% of what they had for the entire fiscal year 25. So a 25% increase in what they had for all of last year in terms of referrals. About 1 in every 4 of those referrals actually get seen in the practice. Their data is pretty compelling. So this includes all of the different clinics. That 76% of the patients who come into the JacksCare Connect system had used the emergency room at least up to 3 times in the previous year. And 50% of them admit that this is for a minor illness. Okay, 24 after 12 months in the system, only 24% of them use the emergency room even one time. So that's a 62% decrease in emergency room reliance, which tells you how important primary preventative care is. 297% increase in primary care access for these individuals. The top health zones, again, are Health Zone 1, which we talked about earlier, Health Zone 5, which is the outer rim, and then Health Zone 4 as well, which is more of that kind of west side area. 12 times the increased number of referrals since 2024. So in the last 2 years, their referrals have not just gone up a little bit, they've gone up 12 times the amount that they were before. And what was listed next are the reasons why. There's this live healthy policy through the state of Florida. There's HealthLink Jax. There's the reconciliation bill, which is otherwise known as the Big Beautiful Bill, which has killed the Affordable Care Act. All of those things have led to increases in the need for people to use our free and charitable clinics in Jacksonville. And this is just a bar graph to show how many people have come in. You heard from Mia earlier, they have over 10,000 unique patients just this year at the Agape Clinic. And so this is all true across the board as you look at some of these other clinics as well. 31,000 unique patients are utilizing just these particular free and charitable clinics that we have in Jacksonville. Believe it or not, there are a lot of other ones out there as well, but that tells you that there's a need and why I'm so proud that we have an infrastructure in place to handle some of the issues that are happening with healthcare here in the United States. We are well positioned to handle some of the extra the extra folks that come into play here. Okay, so the Duval County Safety Net Collaborative, there is another column here that includes Agape. So Mia, I did not leave you out. I promise you're on this slide, but it's not showing up. So anyway, so it just shows here at least 3 of the clinics. You can see some of the data. Community Health Outreach does a lot of dental work just through the beginning of this year alone. They've done over $110,000 worth of dental work for our community. Mission House continues to see an increase in patients, and so does the Mass Clinic. So does Sulzbacher, so does Agape. You heard about the 10,000 new patients, and Volunteers in Medicine is also jumping way above what they have done in previous years as well. Okay, so I just wanted to share kind of what we're doing, give you a little background with data, and thank you guys so much for the attention here.
Thank you, Dr. Joshi, for that presentation. So wondering if you can answer just maybe this one question. You kind of touched on it earlier in the presentation about dealing with the politics and maybe like some barriers that would occur. So I was wondering, how do you approach these challenges, maybe like work around them, just to still keep your goals?
Yeah, that's great. The great question. It's challenging, honestly, for all of us. But I think the way that Lynn and I tried to handle this is to be as apolitical as possible. You know, these are issues that affect every single individual, every single demographic here in Duval County. And every single one of us who might need to go to the emergency room is challenged with waiting times. And the reason we have large waiting times in a lot of cases is people who don't need to be in the emergency room are there. And so it's making it harder for the people who absolutely need to be there. So we approach it as a community-wide initiative to keep the entire community healthy. And so if you look at it as, hey, these are investment dollars that are bringing back to us as a return on investment by keeping the people out of the emergency room. We have to pay for indigent care services at one of our major health systems here in Duval County. And so by even leaving the amount of taxpayer dollars going to supporting that particular hospital system, even at the same level over 3 years, is a huge win with healthcare costs going up and we're keeping everything flat. A lot of these programs are allowing us to do that. And so from an economics standpoint, from a healthcare infrastructure standpoint, these are programs that have to continue in place because infrastructure is not just streets and roads and drainage. Infrastructure is also how do you keep people out of the emergency room? And if they need to go there, can they get the care they need? That's what some of these programs are doing for us.
Thank you for that answer. Just want to open up the floor. Does anybody have any questions for Dr. Joshi? No questions? Okay. Well, I guess that's the
I
end of our
actually,
oh,
I
okay.
actually have some comments. First of all, I'm always amazed, Doctor, how much you've been able to accomplish in just a few years. This is just amazing. You know, when you think of, and you've probably seen this before, where the social determinants of health are like a jigsaw puzzle, and you have all these little gaps. And I see how you're filling in those gaps. The problem I see is that unfortunately the boundaries of its puzzle are being manipulated all the time by political forces. And that's just, I mean, it must be frustrating, but hopefully this time around, when we go to the presentations to the city council, they'll see the progress that you're making. And I assume that efficiency has improved significantly as well,
Yeah.
because I don't
Yeah.
think you weren't getting more money, and yet you're helping more people.
No, we're not getting more money. If anything, actually, some of our programs have taken cuts,
Right.
over the last couple of years, and we're still trying to figure out ways to make these programs work and actually be even more successful than they were previously, which I know is part of trying to be as fiscally mindful as possible, but it's like you want to pay for programs that are going to have the biggest impact. And so sometimes the cheaper program is not the best program, right? So you want to be able to utilize your dollars in a way to make it work. And I think part of the why we've been able to have some success to this point is we really have used the feedback from the mayor's transition teams, from the critical quality of life issues task force, from people in the community who see where the challenges are. And so instead of casting a wide net, we're focusing very much on where the issues are. And if we can get the people at the grassroots level who are impacted the most to utilize the services or understand that there are services available for them, then we could start to move the needle. And by collaborating with groups like Mia's group and the entire JaxCare Connect system, having our telehealth program connect with JaxCare Connect, and they also are connecting with the 988 call system, and they understand our elderly food insecurity program. All of these groups are working together. It is truly a jigsaw puzzle. So this group works. What we do here is also working with what the mayor is doing with homelessness and what she's doing with housing affordability and increasing the availability of affordable housing in Jacksonville, and what we're doing with workforce development and what we do with literacy. Believe it or not, all of that is helping us in the health space, right? The more people who have jobs, the more people who make money, the more grocery stores that we have in a community suddenly improves the community health all around, which is why we're also working with the Department of Health to try to get free HIV testing out into the community as well. That collaboration also improves health outcomes. And sometimes it's hard to get politicians to see that healthcare is not like building a building. It requires all of us to work together. Everything that they do, everything, getting rid of the septic system is good for health. Making sure that we pick up our garbage on time is good for health outcomes. All of those things impact health. So every program, every bit of that $2 billion in the budget is good for health too. So we're winning as long as we're all working together.
Sounds great. Well, one last comment, and that is, I hope you're beginning to look at the impact of AI, because it's becoming clear to people who are focused on helping others that it's not just about the impact on workers, which is significant. There's no doubt about it. But more importantly, the question is, how is it going to impact our ability to work together? And it's getting more people to think about the need to work together. And hopefully that will bring people back to the social determinants of health, and assist you and Lynn and all those others that are, and Mia, are working so hard to make a difference.
Yeah, and AI is definitely something, it helps us, identify parts of our community that are most at need. And interestingly enough, Lynn and I met with a couple students from Stanton High School who are developing this amazing AI software that might help us kind of identify what kind of financial benefits some of our health programs could have on those particular communities that are most in need. And so AI can help us in a lot of ways develop statistical analyses and then allow us to utilize our dollars in a way that are spent as fiscally responsible as possible. So yes, we absolutely cannot continue to avoid AI. If anything, we should embrace it and use it in ways that it can help us, and not assume everything is going to be like Ultron from the Avengers.
And I guess one last comment. Kudos on the 988. We had several years ago, we had the director of 911, 988 from Washington, D.C. on a virtual town hall, and he announced this. And it seemed to be a little shaky at first, but it really looks like you've made some huge progress by helping out with that.
Well, yeah, and I will say that in 2023, there was only 13% of the adult population who knew what the 988 number even meant.
Yeah.
Everyone knows 911, but only 13% knew 988. Clearly, the awareness of that number has increased. If you're having a 43% increase in calls in quarter of 25 over quarter of 23, that's telling you awareness is going up. And so if awareness is going up, we've got to have the manpower to pick up the phones as well. And to me, that's one of the more impressive things that we've done with very little dollars, and that is that we've been able to keep the answer rate in Duval County at 88%, despite the increased number of call volume. And that was us seeing the future, seeing that things are going in this way. It's like Wayne Gretzky said, you don't skate to the puck, you skate to where the puck's going. And that's what we have to do in healthcare here in Duval County, is continue to look at what our challenges are down the road. And if we're preparing for the challenges down the road, then the money is well worth the spend. It's just convincing the people in power that that's where you need to go. You don't go to what's happening today, you go to what's happening tomorrow.
Yes. Well, thank you very much. Those are the comments that I had. And once again, thank you for all you're doing, Lynn, Mia, and all of your teams and all of those organizations that are helping.
Thank you
Thank
for
you guys so
having me.
much. Have a good night, everybody.
Thank you, everyone.
Yes,
Take care.
thank you,
Bye-bye.
everybody.